One thing you're going to hear me talk a lot about in this healthcare series, in this deep dive, is private equity and corporate healthcare and how that affects us in so many ways. One way that it affects us is we have a problem where we have doctors and nurses that are coming out of medical school, but yet they don't have a job. Why is that? When we have a shortage of healthcare workers, we have more of a need for healthcare workers than we've ever had before. And the reason that's happening is we've had so much corporations, private equity, they're buying these hospitals, buying these facilities, to where in a city where maybe you used to have 3 or 4 facilities or more to choose from, you now have 1 or 2. So with less choice, without a free market, you're having these massive corporations setting the price of things, setting the wages for their healthcare workers. So there's not an incentive to go to medical school because you're coming out of medical school, you don't have anywhere to work, even though there's more of a need for healthcare workers than ever. So corporate healthcare and our healthcare crisis is not just affecting everyday people and patients and what they're paying when they're interacting with our healthcare system, but it's also affecting our healthcare workers, and it's affecting the quality of care that we're going to be able to offer people. So our healthcare system is in crisis way beyond just the insurance side of things. We have a crisis when we don't have an incentive for people to go to medical school, when we have a need for healthcare workers, but we don't have jobs for them. We have a few companies controlling the cost for everybody. We're going to talk a lot more about corporate healthcare, and I can't wait to show you guys what I've learned. See you in the next video.